Oh, complaints on my phone. Yeah. You be within your frame.
Okay.
Yeah.
Better?
Oh yeah, you look perfect. So that was just a message. Okay, well, I think I'll just go ahead and get started, or maybe give people like 4 more minutes.
Okay,
Welcome,
fine.
welcome. Thank you all for joining. I haven't done live show in a while.
Oh, really?
Not for the lack of trying. It's just, the streets got it with things opening back up. Life has been busy, but having to bring this person on the show means a great deal because number one, what she does is amazing, and who she is and her passion is so palpable, and her story is, really amazeballs. And I know this is just the beginning. There's greater things to come from her portfolio. So, guys, if you have whatever your questions might be, just put them in the chat box. So we also have a Q&A session towards the end where you can, unmute and ask your questions. But she is very enthusiastic about what she does, and she's changing lives in every sense of that word. So we're going to explore those things in detail shortly. For those that are new to the show, maybe when you're listening to this is the More Sibyl podcast, and my name is Mel. I'm many things, but one of the things I really, really enjoy about what I do is getting to talk to people and, exploring stories, exploring processes, see how we can build community. I'm very big on community. That's my calling, like the big C word, and I know we're talking about cancer right now, but the C here is community for now, okay? And so how we can connect people with stories and encourage, one another in our journey. That's really what I do on the show. And this is an aspect of the podcast, which is a live show. We also have the recorded portion of the podcast, and where we've explored stories since 2018. And we're currently on the 4th season. So there's so many stories. Name a topic we've probably explored it. And if we haven't explored it yet, it's your opportunity to engage with us and let us know, hey, you haven't talked about this. Bring somebody on the show to talk about that. I always love when I get that kind of feedback. So get yourself settled in. A lot of what we're talking about today will be revolving around cancer in developing countries, especially in Nigeria. And I know for some of you listening, it's probably a topic that hits very close to home. Chances are, even if you haven't gone through it, you know somebody who has, could be a family member or a friend. And that's just I guess the pervasiveness of cancer. It touches each and every one of us. Personally, for me, I have lost people to cancer, and it's actually one of the reasons why I'm in cancer research today, because I lost a father figure to prostate cancer when I was just, in my when I was 19, and seeing him just become a decimated version of himself really spurred me on to do something about cancer research. So that has been the passion that has been fueling my research for cancer. So yeah, without further ado, I think this is actually the best time to introduce our guests. I think we've had quite a number of people join. So okay, welcome. This is the show again. And today's topic will be on cancer awareness and also advocacy. A little bit of statistics before I formally bring today's guest in. As of 2012, cancer has, become responsible for more than 70,000 deaths in Nigeria, which is saying a lot because anytime we get statistics from my country, my lovely country, Nigeria, they're usually underestimated. So when I hear 72,000 deaths, I'm thinking more like, let's multiply that number by 3, because when some people die, people like, he just died though, brief illness. What's that brief illness? From there, we don't know what the brief illness is. But let's just go with the official stats. It's claimed more than 70,000 lives in Nigeria. And every year, there are about 100,000 cases, new cases coming in every year. And when you talk about some epidemiology stuff like mortality and incidence, so mortality is death rates, incidence means new cases. The ratio of those two factors, the mortality to incidence ratio of cancer in Nigeria, it's actually very high compared to other nations. And in Africa as a whole, which is a continent, the cases we see, they are usually late, when they come at that stage and grade of presentation. And then we also have other systemic factors, like there's low access to treatment, and then the outcomes, are really poor. And we've survived a lot in Nigeria, or even Africa as a whole, Ebola, malaria, poverty, right? But we've seen that as people are beginning to survive the burden of infectious diseases, like HIV, for example, the numbers have gone down a little bit. We're seeing increasing cases of non-infectious diseases like cancer. And one of the biggest reasons for that is we're living longer. And the longer we live, the more we see these cases. And especially in Nigeria, we're beginning to see high cases of breast cancer, cervical cancer, and prostate cancer, especially among those that are younger, which is quite disturbing. So today, I'll be talking with someone who's the founder of CancerAware. Now, CancerAware is a cancer intervention non-profit organization in Lagos, Nigeria, whose mission is to reduce the rising cancer incidence in Nigeria, especially among women. I met the founder, Tolulope Falowo. I met her here actually in the States. We were both fellows at the NIH National Cancer Institute in 2019. The summer of 2019 was great. And the moment I saw her and I just, heard her talk, I was like, wow, who's this person? She's got a business degree and she's talking about cancer like this. I knew, she had a lot of stories in her. So it's such a huge honor to have her on the show today. I have spoken a lot more than I should. So everyone, please join me in welcoming Ms. Tolulope Falowo to the podcast.
Thank you so much, Mo. It's a pleasure to be here. Thank you. Great show you have. Thank you so much for having me.
Oh my gosh. You're welcome. You're welcome. So let's just start from the beginning. Tell us a little bit about you. I know you're so accomplished and you're one of those people I think of people that can make a pivot in their career and go on to do different things. How was that like for you? Because I know a lot of my listeners are probably at those crossroads where, well, I studied one thing, but I'm doing something else and I want to get myself comfortable, but I think I'm very passionate about that. So let's just talk a little bit about how you grew up and what even got you into cancer space in the first place.
Fantastic, thank you. So, well, to talk a bit about CancerAware and what we do, and then back to how I got into it. So CancerAware is a women's cancer charity in Lagos, Nigeria, like you stated. We focus primarily on breast and gynecological cancers. People always ask me, why women cancers? Why not focus on all cancers? And the answer is really simple. Breast cancer is the #1 cancer in Nigeria in terms of incidence and mortality, followed closely by cervical cancer for women, also in terms of incidence and mortality. And it's been like this for years. It's very appalling that a highly preventable cancer like cervical cancer is the #2 cancer among women in Nigeria. So we focus on this because basically they have the highest incidence and mortality rates. And in my own opinion, a national emergency should be declared in the cancer sector, in the cancer space, to tackle these preventable cancers, including prostate cancer and the other cancers that have high incidence. So back to me, how did CancerAware start? There's actually an interesting backstory to that. So after I finished my first degree and did my NYSc in Nigeria, I proceeded to the UK for my master's. I went to the University of Sheffield, where I got my MSc in International Business and Management. As a student, I was routinely invited for a pap smear, which many of us may know is a form of cervical screening test. Up until then, I had no idea what a pap smear was. I'd never heard it. I did not know I needed to have one done. This was in 2009. So I went in for the procedure. After I repeated letters from my GP, I eventually went in, and it was a very smooth, easy process. The nurse was very attentive, educated me about it. And 2 weeks later, they phoned in my results, which were normal. And they told me I needed to repeat it in a couple of years. So fast forward, that was when the seed for CancerAware was sown, but I didn't even know at that time. Also around that time in 2019, there was this reality TV star in the UK called Jade Goody. She was a TV reality star. I think she was 24 or 25. And she came down with cervical cancer, was detected stage 4. And she eventually passed. But before she did, she worked with the UK government and the National Health Service in developing a huge campaign around cervical health and cervical cancer. Everywhere you went, there were posters about getting your pap smear, about the HPV vaccine. It was really huge. In fact, there's something called the Jade Goody effect, because by the time she died, they had those rates for pap smears. I mean, the demand for pap smears went through the roof in the UK. Anyway, so I worked for a few years in the UK, finance, then moved back to Nigeria in 2012. Around that time, I was due for my next pap smear. And I found it interesting that I could not find any information about where to get pap smear in Lagos. It wasn't available online. My hospital then didn't offer pap smears. And I was a bit disturbed. Eventually, I got a place to do it. And then I started to research more and found out that, okay, I thought about it. If I, with my access and everything, cannot get this information or get this test easily, then what about the women up country, the villages? And then I read that cervical cancer was responsible for one woman's death every hour in Nigeria. This was in 2012. I was bothered, and I wanted to do something about it. I didn't know what I was going to do about it, but I knew I wanted to do something about it. And what started as an information resource quickly morphed into a full-fledged women's health initiative, and we were incorporated in 2015 as a charity, even though we were founded in 2014. And by the grace of God, we've become one of the most visible cancer charities in the country. We screened over 8,000 women for both breast and cervical cancer, in addition to our other various interventions and programs. Thank you.
Wow, what a story. Let me just pedal back a little bit. When you're talking about your first experience with cervical cancer screening, like to do the test and all that, you called it a smooth and easy process. Please, what's the name of that, your nurse? Because that speculum going inside, like there's nothing really smooth and easy about it. But, I'm glad you had a very good experience, because I've had friends that, they couldn't even get anything inside there because it was just yeah. But I think it's funny that, how we just find our calling in the most unusual of places. And I always believe that there's always that seed of greatness in every one of us. And how we come about it might sometimes be in the most, unusual circumstances. But kudos on you for not just satisfying your own needs about, okay, once I found a place in Nigeria, finally to get my, my pap smear done, I can just move ahead. But you realize there was a need, and leveraging your background in finance and just what you know about, cancer advocacy and all that, you made CancerAware happen. So I wanted to just highlight that importance of, there's always something in our environment that God is trying to show us to pick on, and you saw that, you went running. And so let's talk a little bit about just the infrastructure of Nigeria. And I know for those that might be listening, if you're not from Nigeria, say for example, you are from a low middle income country or a developing country. So we might talk about Nigeria a lot, but I can imagine that some of the things we're talking about might be relevant in your own country as well. But because we are both Nigerians, a lot of the examples we use in Nigeria will be Nigerian. So Nigeria is wonderful. We know that it's a great country. It's, it's struggled through a lot. We've gone through a lot of repressive era. And some might even say we haven't even come out of that repressive era, but who am I? I'm not quite a skeptical person, right? But the country, when I think about just the monetary value of health in Nigeria, or even the monetary value placed on lives, it's quite appalling. And I say this to say that there's so many interventions that could be done primarily in reducing, non-infectious diseases, the burden of the diseases, like for example, cancer. And I say that because I remember when I used to work in Nigeria, I used to work with a HIV clinic, and this was funded by the Harvard School of Public Health then. And the aggressive approach used to curb the spread and also the death rates from HIV was quite impressive. And I dare say those similar models could, be expanded to cancer, but of course, with the federal government of Nigeria playing a more active role. So let's talk a little bit about just what your thoughts are about, number one, the health infrastructure in Nigeria and how that can be impacting cancer outcomes, among our population?
Thank you, Mo. Nigeria is seeing a rise in cancer cases, especially the more common cancers. We talked about breast, we talked about cervical. There's also prostate, liver cancer, non-Hodgkin's lymphoma. The IARC, the International Agency for Research on Cancer, the global statistics that came out last year, 2020, lists the top 5 cancers in terms of incidence. Number 1, breast; 2, prostate; 3, cervical; 4, non-Hodgkin's lymphoma; and 5, liver cancer. Mortality is also close. Liver cancer is number 4 and non-Hodgkin's number 5, but the first 3 remain the same. So it's everywhere. And for us who are at the forefront, we're seeing cases. Breast cancer, the women are getting younger. There's more aggressive disease. There's late presentation. Late presentation for me is one of the biggest challenges. And the reasons why people present late are many. Number 1, in my own opinion, is poverty. We are the poverty capital of the world. It's the reality. Many people cannot afford preventative healthcare. They cannot afford treatment when they do come down with the disease. And this is not just about cancer, other chronic diseases. And also the fact that most of our healthcare is funded by out-of-pocket payments is a huge, huge factor. We have the National Health Insurance Scheme, but how many Nigerians are on the scheme? How many Nigerians are eligible to be on the scheme? Okay, so let's talk about the private health management organizations, also known as HMOs. What are the eligibility criteria? How many people can meet it? How many people can pay the premiums? So that, for me, is the crux of the matter. People cannot afford healthcare in Nigeria. So, for example, you're seeing a woman coming in with a golf ball mass in her breast, and you ask her, "Madam, how long have you had this?" And she says 4 years, or she says 3 years, that it was small and it's grown. Why? Why did you come to the hospital? By the time you probe, you find out that it has to do with funding. Number 1, there are other factors. Ignorance, lack of awareness. Though I must say at this point that when we started CancerAware and to where we are now, there has been a good drive in terms of awareness. More people are aware about cancer. And this kudos must go to organizations in the space who are working hard to educate the public. But after awareness, then what? There has to be action after awareness. There has to be screening. And for abnormalities, there has to be treatment. There is a huge lack of infrastructure. We don't have one comprehensive cancer center in Nigeria that we can point to. We have less than 10 radiotherapy machines for the whole country. A country of almost 200 million people. We should have at least 200 machines. So there's a huge problem. The government, in my own opinion, does not have the political will to intervene in the cancer problem in Nigeria. HIV is easy. It's a low-hanging fruit for them. Maternal mortality, child malnutrition, those ones are easy, and there's a lot of funding. But cancer is a huge resource disease. But the reality is it is killing Nigerians. It is killing women. It is killing men. So something must be done.
Oh, wow. I mean, I almost feel like taking just a 1-minute silence to kind of, reflect deeply on what you just said, because those are really heartbreaking statistics. And unfortunately, it's just the reality in Nigeria. And you've hit the nail on the head. So as a health economics, I know that there are different healthcare models around the world. Countries like Canada, they will have like the socialized insurance, similar with the UK as well. But in Nigeria, out-of-pocket model is not really sustainable for a country that is already living, like 7 out of 10 people are living, in abject poverty. And so healthcare becomes that thing of, is the last resource. If you haven't fed well, you haven't sent your kids to school, sent yourself to school, put a roof on your head, healthcare becomes a luxury. It's like, Disneyland for most people. Like, we'll get there when we get there, but not now. And you've hit the nail on the head about just, the other things that the government has done quite a, good, let's just put good, job on, like HIV, for example. But I know with that, there's also been some problem, because I know Harvard PEPFAR, or APIN, which is the AIDS Prevention Initiative in Nigeria, they've had to, like, slow down a little bit from funding Nigeria because there's been a lot of mismanagement of funds and the federal government not committing, what they said they were going to do. So, and then another thing you said, which I think we should, emphasize on, is screening for any kind of cancer. Really, I think the best way you can actually save yourself is to know it in time. And I want to say this, and I want to say this carefully. The best time to have cancer is this time of the year, not that time of it, this season of life, as far as this age, because when I say age, this era, because the sophistications of technology that we've amassed so far can help with easy detection. So knowing your numbers, knowing what your risk factors are, knowing just, what's going on with you right now is probably the best. But that story just doesn't end there. For Nigerians, even having cancer is almost like a death sentence, because for cancers, for most cancers, the survival rates. So when we explore how long you're going to live, we use words like the 5-year survival, meaning in 5 years' time, what is your rate of being, your odds of being alive? For example, prostate cancer has about 90 to 99%. Those are very, very good odds if I were to be a gambler. Cancers like pancreatic cancer, they're probably the worst cancer you want to ever have, because only about 9% of them are, have very good odds. There's usually a high death rate with, pancreatic cancer. But the cancers we're seeing in Nigeria, like breast cancer, prostate cancer, cervical cancers, these are cancers that, if detected in time, they can be treated well. But the problem is that when you have someone, a Nigerian, walking to the clinic, they've probably known that something has been going on for a long time. And so that's what I want to speak to. And so, Tolu, I'm just curious, for those that might be listening, we've talked about cancer advocacy, we've talked about, screening and all that. Given that our government right now has placed little or no value on our lives, because the health budget, for example, keeps shrinking every year and year. And because I've sat down, I actually just wrote a paper recently that was published in Nature about cancer care and behavioral research in Nigeria. And so I had to sit down and read the National Cancer Care Plan that was, set out by the Nigerian government. And you could tell that when it came to cancer, there's really not much, that they're really doing, which is quite problematic. So for Nigerians that might be listening, for those that might, not have a lot of income to go screen, or maybe travel to India or all those hotspots for, medical tourism, how can we save ourselves? Pending when the government wakes up and realizes that this is actually a problem that they need to address.
Thank you, Mo, for that question. I have to say that in terms of cancer, like you rightly pointed out, our government is failing woefully. The National Cancer Control Plan 2018 to 2022 has hardly been implemented. And 2022 is around the corner. Okay, take cervical cancer, for example. Cervical cancer is a cancer, in my own opinion, that should not happen. Why? Because it's almost preventable, almost 100% preventable. We have the HPV vaccine, and with regular screening for women. But guess what? Nigeria does not have the HPV vaccine in our immunization schedule. This has been an advocacy campaign that we've been on since 2018. It's called the 14,000 Reasons campaign, because about 14,000 women die from cervical cancer every year in Nigeria. We have an online petition that's amassed almost 50,000 signatures, asking the government of Nigeria to include the HPV vaccine into the immunization schedule so eligible girls can access it. It might interest you to know that other smaller African countries, such as Rwanda, Zambia, Tanzania, Kenya, have all introduced this. Meanwhile, we have the higher cervical cancer burden, and we've not. Although I'm aware that shortly before the pandemic, the COVID-19 pandemic hit, that the National Primary Healthcare Development Agency was in talks with Gavi, the Vaccine Alliance, to see how they could get the vaccines in. And I hope that once things normalize a bit, they would really hurry and get this done. We're losing too many women to cervical cancer and other cancers. Regarding what we can do to save ourselves, well, we have to focus on preventative healthcare. We have to take our health checks seriously. Nigerians do not take health checks seriously. Would rather buy a shwebi or and one of the reasons I wanted to mention is religion. religion is a huge, huge factor. It's not my portion mentality. It can't happen to me. It can happen to others, but it can't happen to me. I'm a Christian, I'm a believer. And I believe there's a place for prayers, but there's also the place for healthcare. As you're praying, you're also doing your wellness checks, you're doing your health checks. If you find something is going on, you seek medical help immediately. You don't delay, you don't wait saying you are praying, okay? But then again, it also leads back to the first point I made earlier, that the lack of infrastructure. Take the case of the UK. Look at my experience getting my pap smear. I didn't have to do anything. There was a call-up service that identified that, okay, there's a Tolu here. She's eligible for a pap smear. Get her in for a pap smear. So I didn't have to do anything. What is wrong with us having a national cervical cancer screening program or a national mammography program, whereby eligible women can just walk to a primary healthcare center near them or a secondary tertiary institution and get it done? If that was in place, then people would be more willing to seek healthcare. But anyway, since that is not in place, among other things, we have to take personal responsibility for our health. Since we are talking breast cancer, cervical cancer here, we have to take personal responsibility for our breast and cervical health. Women, we have to do our checks. If you're 40 and above, you have to start your mammography. There's a family history of cancer and you're below 40, you have to speak to your doctor about starting screening earlier and personalized screening. You have to do your breast checks every month, your breast self-examination. On our social media channels and website, we have videos and instructions, tutorials on how to do it, because many women don't know how to do the breast self-examination. We have to take care of ourselves. We have to choose preventative healthcare. And when there's a problem, we have to seek healthcare help immediately. I think that's what we can do. And in addition to that, we also have to lobby our lawmakers, because all these things we're saying, if the right that example I gave of the NHS and the call-up system was as a result of a policy that was passed. We have to lobby our health lawmakers to pass the right policies regarding healthcare. It can affect any of us. No one is immune, rich, poor, whatever tribe you are. Anyone can have, and I've seen it, I see it all the time. Cancer is a very, very, very terrible disease. Financially, mentally, emotionally, it's terrible. Something must be done.
Wow. Thank you so much for that robust response, Dolo. And guys, I have put her website on the chat, in the chat button, chat section. You can click on that. You can follow them on Instagram. They have wonderful graphics. Now you said a lot, so let's unpack that a little bit. Definitely, knowing your numbers. Okay, let me just confess this. When I have to go into my gynecologist office, I almost always have a panic attack. And this is me. I just, it's just, I've been there so many times that it's for different reasons, but I still go every year anyways. I'm ready to put that, the satisfaction and the anxiety feeling aside and know that, okay, I need to do this every year. So I do my yearly checkups. Okay, I do that. And I it's something I also make my parents do every year. And the way I've come to reason it is that, yeah, I'm going to be a little bit uncomfortable. I might want to break down a little bit and cry while I'm in there, but it's better for me to know my numbers. And if you don't have a baseline, your doctor won't know what has shifted in the past year. Okay. So no matter how terrible you think the experience is going to be, that peace of mind in knowing that it's just this one time a year, let me go and check this done. I've known of people that they go every year, and within the space of a year, they were diagnosed with, I have a friend right now that's had lung cancer stage 3, and it happened within the space of a year. What was she exposed to? She was working, I'm not going to say exactly where, so I don't give her identity away, but she was working in a place that, the environmental toxins, got her exposed by nature of her job to where she was. And so this is someone that was going every year for her checkup. Imagine if she wasn't doing every year and then she went like maybe 4 or 5 years down the line. She probably won't be alive today. She's still having to go through the treatment, and it's so horrible. Cancer will drain you, whether you're rich or poor. it will drain you. But the good news is that some of these cancers, if detected in time, you're able to live on, considerably healthier lives. And Tolu will share a little bit of some, good examples later on. Another thing I also want to highlight from what you said is family history. As someone who's studied cancer extensively, especially among Blacks, we found out that a lot of people don't even know their family history. And that's because we don't share them. Be to like protect our family members, not to make them worry.
Very hush hush.
Exactly. It's hush hush. I had, so I'm right now, I have a grant funded by Department of Defense, and we're exploring quality of life for prostate cancer survivors. I had a man tell me he's based here in the US, right? So it's not about him not being aware. When he got the diagnosis, he sent his wife and his kids packing to Nigeria for vacation, and he didn't tell them he had prostate cancer. And he went ahead and did the therapy by himself. And then when he was done, after several radiotherapies, he sent his wife back to the US. And of course, so I asked him, if you could do things differently, what would you do differently? He said, I would have just told my wife about it, because it broke her heart that she didn't know he was going through that. But for him, it was him just caring about his family. He wasn't thinking that, it was a bad thing to have done. At that moment, he thought it was, saving his family. So for moms, dads, people that listen to this, please let your children know when we withhold information that can impact their health, we're actually doing more harm than good. And so some cancers with strong familial link, like prostate, breast, cervical cancer, if someone has had it in the family, chances are the first degree relatives, like kids, can also have it. So it's good to know your numbers. Yeah. And now we're even seeing very aggressive forms of cancer, like triple negative, breast cancers. What does triple negative mean? It's the therapy for it is so expensive. It's not going to respond to so many common therapies. And we raised money last year, for example, for one of my friend's sister, Ada's sister. And it was a very sad, story, the way the cancer came about, because she was even taking a lot of precautions. She finally went to see a doctor. They went ahead to do a surgery that they shouldn't have done in the first place. And of course, that led to a cascade of events. And thank God she's still alive and she's still going through therapy. So all I'm just trying to say is that please make sure you know your family history. While you're sitting down at the table talking about Ashwebi and where to go on vacation, health should be discussed. We are very socially cohesive. As an African, I'm very proud to be African, because there's that connection we have that is just not like any other, group that I've seen so far in the world. And we share so much. We want to pass down our culture, our love for life, our love for people. Can we just add health to that list? How's your health these days? Mental health, your values, and it's not just, cancer as well. Other health indicators, being in the know of that. And then it's very cost saving. Detecting cancer in time, and I think this is something the federal government should know, is actually cost saving. If you sit down and do the math, any health economics, who's what they're, box in degree or whatever knowledge, they will tell you that once you can start working on primary prevention, the tertiary aspect of it is cost saving. To give free screenings, or even subsidized screenings, or even give vaccinations and make it routine, it will save us a lot of money and to reduce the burden on an already fragile healthcare system. So I don't know who's making these decisions. I don't know how come they're not even thinking about the future and just the longevity of it. Another problem. Sorry, go ahead. Interject away.
I actually think that, I think that it's actually an economic decision to prevent chronic diseases, the ones that are preventable. I'll tell you what I mean. Still using my pap smear example, because it was on the NHS, it's covered, so I didn't have to pay anything. But obviously the government bears the cost. The UK government bore the cost. So let's say it costs £10 to give me that pap smear, okay? Now, assuming someone did not have the pap smear and the person comes down with cancer, in cervical cancer in maybe 15, 20 years, the economic, first and foremost, probably will not be able to work after a while. They'll go on insurance, social insurance, disability, I don't know what you call it in the US. There'll be loss of wages because they're not able to contribute.
Productivity loss, yeah.
Productivity lost. They won't be able to pay taxes. Then the emotional burden and mental burden on the family will also affect those ones. So in the long run, it's then the cost of treating it.
Yep.
So I actually think it's an economic decision by the government of the UK in this regard, using them as an example, of course, to actually prevent. So they're not stupid. They are investing in so that they won't have to pay more and lose more in future. So it's a win-win for everyone, for the citizens, for the government, if there's a lot of focus and investment in preventative healthcare. That's what I believe.
I mean, that's so spot on, because in economics, we're looking at not just the direct medical costs, we're looking at indirect costs, we're looking at intangible costs, we're looking at, even those extra burden. And yes, I mean, you're so right. If you can put the numbers together, it's long-term cost savings to get to do that. And even here in the US, given how capitalistic sometimes these policies can be, your yearly checkups, you don't pay anything for it. Your insurance actually covers that because they do know that when they screen things in time, say for example, your A1C for your blood sugar, they do like cholesterol, they do, all your workup every year is free. I don't have to pay anything every year when I go do my yearly checkup.
Very good.
I think another thing to also even mention is that place of religion, right? And I have seen that be so pervasively done. And I imagine that even Jesus is not happy with it. Yeah, so myself and Tolu were both, we're Christians, right? We believe God and all that. But sometimes you see a lot of things that is really done in the churches, and I'm going to use churches as an example, where we kind of put a bad name on seeking, Western medicine and priding it has to be faith, like you have to have faith. So buy this anointing oil, rub it on your. I heard of a woman that was having definitely a mass was growing on her breast. It had gotten to that place where it was dripping and it was smelling badly, and her pastor told her to just keep putting anointing oil on there. Say, I speak in tongues. I believe in the power of anointing oil. I believe in the power of casting out demons as well. But at that stage, I'm like, is it not the doctor that God has given them the knowledge? And I think when you talked about that religiosity, I think that's also something that I feel like we need to expand, because I feel like as Africans or even Nigerians, that's one of the biggest things that actually, holds us together, our faith. We tend to believe in God, whether you're Christian, Muslim, or, or you don't fall into whatever category. And so I don't know what, for example, CancerAware is doing. You guys do some, I want to say maybe outreaches with the churches. What level of involvement, if any, have you had with religious organizations to drive home that message? Because I imagine that if an average Nigerian is hearing their pastor speak about the merits of screening or even getting tested or going to get their wellness check done, that might also help with, increasing this proactiveness regarding, cancer outcomes.
That's a very good point and question. So over the years, yes, it is true that Nigerians we're very religious, and we pray a lot, which is fantastic. I must say at this point that going to the hospital or seeking healthcare is not an indictment of our faith. In fact, it's an appreciation, in my opinion, it's an appreciation of medical science, which I believe God gave us. So seeking help when you need medical help is not an indictment of our faith. Over the years, we've worked with churches. Majority of the churches, especially the bigger churches, actually encourage their population or their congregation to seek healthcare. In fact, the bigger churches, you'll see that they have hospitals in their camps or in their headquarters and things like that. And they also have medical missions and outreaches. So a lot of them are actually doing well and encouraging their congregants to seek help. But that being said, it's true, some people would not even seek help, even if their pastor tells them or their imam tells them to seek help. Even though they listen to them, sometimes they will not seek help because of the other factors, the cost. That cost is a huge, huge factor. It's all tied together. So over the years, we've noticed that more and more churches are encouraged, and I use churches because those are the ones we've worked with in the past, are encouraging their congregants to seek help. And I think one of the reasons is this. When a person, especially when it's an indigent or low-income individual comes down with a chronic disease like cancer, yes, the first place they go to raise funds for their treatment. Their religious institution, after they've exhausted family and friends, their religious, we write a lot of letters to address to their religious institution asking for funding to help for the patient. The patient asks us to write on their behalf. So that's where they go to. So imagine if you're a church with a congregation of 1,000 people And on average, you're getting maybe, I don't know, 20 requests or 30 requests in a quarter. That's a lot. So it's also a burden on them. You know, they will have to fundraise, they will have to probably have a welfare fund or whatever. So that has been, in my opinion, an incentive for more churches and religious institutions to encourage their congregants to seek preventative health care and also to seek medical care when they do come down with these diseases. And that being said, a lot needs to be done. More needs to be done in getting the churches and the mosques on board. Shortly before COVID hit, we had a conference planned in 2020 that was supposed to have a side meeting for religious organizations. So we're going to have representatives of churches, the major churches and the mosques to come. And, you know, we wanted to let them know that we're in this together, you know, the religious institutions, the advocacy organizations, the hospitals, the doctors, that we are all on the same side. You know, we want to reduce the incidence of cancer. We want to reduce the late presentation of this disease, and we need their help. A lot of people listen to their religious fathers, their pastors and their imams. They tell them, go and do this, they will do it. So we actually need them to work with us. But I've seen progress over the last few years from religious institutions in that regard.
That's really good to know. And I like that emphasis on community partnership with them, because as bad as some of them can be, we still need them. Maybe it's even that factor of training the trainer, helping them see the problem. And so when you're talking about some churches who are now, you know, being the forefront advocates for primary prevention, it reminds me of the UK government, that analogy you had given. Now they're seeing the burden of having to pay for therapies, so they're trying to make sure that their members are being proactive. And so thanks for that reminder. We had a question.
A lot of invitations from churches.
That's good. That's really good.
Their women. A lot of cases have been detected from those kind of outreaches. You know, where they just screen their congregants for free. So,
Well, before the next question I was gonna ask you was to talk a little bit more about, you know, some of the things you guys do at CancerAware, because I know of some of the work you do, because I referred a lot of people to you. But we had a question from Nosokun. She said, how often should a woman do pap smear, mammogram, and also what is the benefit of taking the HPV vaccine? And before you answer that, maybe just explain what the pap smear and the mammogram and all that does before, so for those that might not be aware of what they do.
Okay, thank you, Nosokun, for your question. So a mammogram is like an X-ray of the breast. It is used to detect any abnormalities or changes in breast tissue, and it's used to catch breast cancer. It is recommended for women screening mammograms. There are two types of mammograms. There's screening mammogram and there's diagnostic mammogram. Screening mammograms are for women who have no abnormalities, and is recommended for women aged 40 and above. Diagnostic mammogram, on the other hand, is for women who have maybe picked up a lump by self-examination or clinical breast exam, and the doctor sends them for a mammogram. It's a simple procedure, it's painless, you know, it helps prevent, it helps detect breast cancer early. So it's a win-win. When breast cancer is detected early, the chances of better outcomes are high. The problem we're facing in this part of the world is many women are detecting their breast cancer late. I must at this point say in Nigeria, over 50% of breast cancer cases presented in our hospitals present at stage 4 at diagnosis. So you already see where the problem is. We're having women coming in with liver, lung, bone mets at diagnosis. So that's for mammogram. Pap smear is a screening, it's a cervical screening test. It is not to detect cervical cancer. It is to detect precancerous changes on the cervix of a woman. As you know, a cervix of a woman is the top of the womb. I think that's what they call it. You know, so the opening of the womb. So there's a virus called the HPV virus, the human papilloma virus. It is the most common sexually transmitted infection in the world. It is so common, 4 out of 5 sexually active people have had it at one point or the other in their life without knowing. It has no signs or symptoms. Most people's immune system clears it, but in some women, persistent HPV infection can lead to changes on their cervix, quiet changes over the years. The woman doesn't know because she's not getting tested. This is where cervical screening tests come in, like pap smears. We also have liquid-based cytology, which is like the gold standard for cervical screening tests. For low resource settings, we have the visual inspection with acetic acid, which is used for like the mass outreaches that we have. So all these tests, and then of course we have the HPV DNA test, which is done in addition to with the liquid-based cytology. So the purpose of all these cervical screening tests is to detect precancerous changes on the woman's cervix before it develops into cervical cancer. And it will interest you to know that it can take up to 15 to 20 years for full-blown cervical cancer to happen. So that means if a woman is having a regular pap smears or cervical screening tests, if there are any changes, she can detect it and it can be treated on time before it becomes cancer. The HPV vaccine has been a game changer in the area of cervical cancer, which was one of the things I was talking about, the fact that we don't have it in our immunization schedule in Nigeria and why we're working to get it in. When the HPV vaccine is given before sexual debut, that's before a person becomes sexually active, that is when it is recommended because they've not been exposed to the HPV virus. So that is why it's recommended for children from age 9. Different countries have, I don't know in the US what your minimum age is. I think it's 9 more. Is it 9 or 11?
I think 9, yeah.
Yes, in the UK, it's up to age 26. You can have the vaccine up to age 26. But I know there is Gardasil 9 now that I think the FDA approved up to age 45 because it covers other strains of the HPV virus. The HPV virus has over 100 strains, but it's 2 strains, strain 16 and 18, that cause cervical cancer. So the HPV vaccine protects you from getting the virus, which can cause the cancer. That being said, for adult women who are sexually active, you might not really benefit from the vaccine because you might have been exposed to the virus already. That being said, if you have access and cost is not a factor, you can still take the vaccine. However, you have to do your screening regularly. You have to have your pap smear, you have to have the liquid-based cytology, whatever tests is being done in wherever you are. You have to do your cervical screening tests regularly, as and when due. So if there are any changes, it can be treated on time. So I hope that answers your question, Nurse Okon.
I just said that was a very robust one. I'll watch out for the chats. I also want to just add to this that I know we've talked about girls taking the vaccine. They also recommend it for boys as well.
Boys, absolutely.
And I know some of the problems we're having, especially in the northern part of the country, has been that misconception about how the vaccine is linked to promiscuity in young girls. And so the uptake rate has been quite low in those regions of the country. Now, Penny, when we have more questions, let's talk a little bit about CancerAware. So I have referred people to you, and one thing I love about Tolu, guys, is that I text her, I'm like, Tolu, we have somebody, and then we go over the case. She goes like, oh no, why didn't they? I mean, there's always a commonality to the stories. Most of these people didn't check it in time. But Tolu is so good in the sense that she looks at their cases. I sent her the reports. She goes, oh, they need to talk to this doctor. Oh, why are they based in the country? Oh, they need to move to the nearest center. I can set them an appointment. Click this link. She's so resourceful, guys. And I don't even know how she does it. And I think it's just a testimony to just how passionate she is and how truly she wants to be like this, I guess, a warrior, a campaign, running that campaign against cancer in such a way that people can feel supported. And there's nobody I've referred to her that she's turned down, never. I even had, so a case in point, my friend's sister, Choma, who we raised money for, Tolu was able to help them get, because she had triple negative breast cancer, triple negative, which is like the
no, HER2. She has HER2 positive.
Sorry, HER2. Sorry. Thanks for that. It's still quite expensive. The treatment for it, accepting, it's quite very expensive. Tolu was able to help them get a good discount on it, and that helped them to save money on the long run. So tell us, how do you guys do it, number one, and where are you getting funding from? Because we know as an NGO, this is, I'm sure you're even doing that out of pocket model, because a lot of what you get is just going back to help people. How are you funded, and how do you just keep doing this?
Thank you very much for that question. Honestly, funding is the lifeblood of any charity globally. When funding is not available, you can't do your work, you can't have impact. So we're funded by donations from individuals, donations from local organizations, and most of our major projects have been funded by grants, both local and international grants. You know, but donations, individual donations, we have donors who give us money every month, you know, monthly giving, they're ones who give us one-off. That's how we're able to do this. And we've also built relationships with all the relevant stakeholders in our space. So for example, our patient support initiative, which provides free cancer treatment and has supported over 150 women with free cancer treatment, chemotherapy, radiation therapy, surgery, medication. We even cover feeding, transportation, caregiver support, name it. You know, so we, for example, we've partnered with the pharmaceutical companies that bring in chemotherapy drugs, and they give it to our patients at discounted rates. You know, and we're also able to get it at discounted rates to offer it free to our most indigent patients. You know, we have partnerships with diagnostic centers, with hospitals, but it's tough running, especially in this environment. It's very tough, and it's just by the grace of God that we've been able to stay the course this past 7 years. For me, one of the things that drives me is the beneficiaries, the real life stories. I see them, I interact with them, and I realize that it could be anybody. You know, a cancer diagnosis, I mean, it's just a couple of cells misbehaving, so it can happen to anybody. That could be anybody. That could be your sister, your mom, your aunt, your uncle, you know. So as much as we can. So if you're watching and you know someone who has cancer, please show them all the love and care you can. It is the most challenging thing they can ever face. It affects them financially, mentally, physically, and not even just them, their family members, their caregivers. In 2019, we started the Moby Pink Breast Cancer Project. It's a project that provides psychosocial support to stage 4 breast cancer patients and their caregivers. You may ask, why stage 4 breast cancer? Well, we identified the problem that stage 4 breast cancer is usually neglected.
Yeah. Mm-hmm.
Because a lot of people think, oh, they're stage 4, they're probably going to palliative care, there's no hope anymore. And we found out that a lot of them, after doing some focus groups, we found out that a lot of the patients were depressed, there were mental health issues. And we also found out that the caregivers were also neglected. Nobody was looking at the caregiver. Everyone was focusing on the patient. Nobody was asking the husband who comes on every clinic appointment, well, how are you feeling? How are you coping? So we developed this program, and thankfully we're able to get funding from the Union for International Cancer Control, SPARC program, to start that project. And we have almost 800 beneficiaries on that project so far. We started a telephone helpline to support the patients and their caregivers. It's tough, but we just keep striving. We thank every donor, everyone who has supported our work over the years, who has made this possible. The impact we're having is thanks to everyone who has supported our work in one way or the other.
Wow, man, that's that's just super impressive, and thanks for sharing that. And I mean, spot on that stage 4 thing. So for those that might not really know, cancer has different stages. They do them staging based on just how it presents and also the grade as well. So stage 0 is, not too bad. And then it moves from stage 0 to stage 4. Stage 4 is usually the last stage. It's a late stage. It's metastatic in the sense that it's spread, to more than one organs, and the odds of surviving is usually lower. So when she was talking about, those are stage 4 and even their caregivers, those are key issues right there, because cancer is a disease that consumes. And when I think about the term cancer, I think about the origin of that word, which is, it's a Latin word for crab. It kind of just, it grips on everything and never lets go. And that's how draining cancer can be. Yeah, your prayers will go a long way, but sometimes even a phone call or a meal prep or just checking or seeing how you can make life a little bit easier for them, a lot of people who are going through this, they need help. And not just them, even their family members as well. Now, speaking of stories, because, stories is something that I feel like, even as a podcaster, it stays with us. If you could just, invoke our imagery with a strong and powerful messages, what are some of the successful stories you've had from your platform, Tolu?
For that question, we have a very robust support group for breast cancer. And over the years, we've built a small community of women who have beaten breast cancer. They have no evidence of disease, they're in remission. We've lost quite a number of our beneficiaries, I must say that. And the reason is not far-fetched from all we've said today. Late presentations, by the time they're coming in with stage 4 disease, there's not much the doctors can do. And then with all the other factors, cost being a major factor, then access to treatment, lack of cancer treatment centers. You're talking about somebody in a village in Kafanchan or somewhere up north or in the east or in the west who has no access to come to Lagos or to go to Abuja or Port Harcourt or the major cities for cancer treatment. And even if she has no money. Our family, they've sold everything, So we've had good success stories. We have a thriving support group of survivors. Unfortunately, we also have a lot of sad stories. And that is why we're working hard to reduce the late presentation as much as we can with awareness and education, things like that, so people can present early as regards breast cancer. And for cervical cancer, that women should take up their pap smears, and also working hard to get the HPV vaccine into the national immunization schedule.
Thank you for that. And I just want to even add that some symptoms, when they begin to show, usually when it's almost too late. So you might feel good, but you might not necessarily be good, and we see that a lot. So I work with prostate cancer, right? For a lot of men that we end up talking to, they go like, well, it was when I couldn't have an erection or when I was peeing,
Mm-hmm.
That's when they realized something was wrong. But if they have been going every year to check themselves up and they can see that their PSA levels are rising, for example, or when the doctor flips them over and checks for that, the feel for their prostate to see if there's any abnormalities in the, the touch and the feel of it, they're able to say, oh, you know what, let's send you for further testing. But if you don't know your numbers, how do you know what's going on with you? Which leads me to my next question from Dr. Adedikwe, by the way. He wants to know, he says, I want to believe that there are guidelines that providers adhere to that include routine age-determined screenings like pap smears, mammograms, etc. These should come up automatically at annual physical exams. He's spoken like a physician, by the way. How can we prioritize annual physicals in Nigeria? And that's a very critical key question.
Thank you for that question, Dr. Adedikwe. That is a tough one. I touched on it earlier when I talked about the fact that out-of-pocket payments for healthcare is a major, major barrier because people do not have enough money. Majority of Nigerians are poor. And then, if they have to seek healthcare, they have to pay out of pocket. So someone who hasn't eaten or who's trying to feed their family, you're telling them to go for annual check. How? There's nothing wrong with me. I'm fine. Why should I go for an annual check? Okay, let's now move to another demographic of someone who maybe they're middle income, they can afford it. They think, oh, yeah, there's really no need. Or even if they do go in, most of the hospitals, majority of the hospitals, only very few are beginning to come up with well woman clinics, packages and things like that, that they will now offer to the patients and say, okay, let's do this. But the reality is the mentality of Nigerians and the Nigerian government is not on prevention. It's more on curating when problem happens. We don't focus on prevention. There is no call-up system. There's no, oh, madam, you are in. Okay, when last did you have your mammogram? Or when last did you do your pap smear? Very few providers have that incorporated into their system, So it's one of the things we're working on. That being said, we've seen a small shift over the years. For example, now a lot of diagnostic centers have these packages whereby there's one called the Well Woman package. You know, it has pap smear, it has mammogram, you know, it has, for the men, it has PSA. I don't know what they call the men's equivalent. I guess different centers have different names for it, you know, and you know, diagnostic centers, you don't need a referral. You can just walk in and get it done. So at CancerAware is one of the things we push, you know, that see, there are these centers. If you go on our website, we have a list of verified centers across the country where people can get mammograms, pap smears. Go there, get it done. You know, so a lot, it has to come from the top. It has to come from the federal ministry. It has to come to the state Ministry of Health. You know, they have to drive this thing. NGOs cannot drive it in its entirety. It's not possible. We don't have the capacity. We don't have the funding. It has to come from the Ministry of Health. And that means they have to make cancer a priority. Cancer is not a priority to the Nigerian Ministry of Health. It's not. It's too tough, it's too difficult, it's too cost effective, it's too costly for them.
And which is, again, it goes back to that piece of, it's still long-term savings if we start focusing on primary prevention right now. And I think another problem, which I'm not even going to go into details, is we lack a centralized registry where we can like follow up people with time. Like,
absolutely.
So the CIE, which is the surveillance and epidemiological data here in the US, is one open access public data where you can look at cancer cases and you can, you know, carry a lot of research for not just for policy implications, but even like follow up, you know, epidemiology and all that. In Nigeria, registries are not very centralized. And if they are, you don't really have access to it. There's a lot of red tapes. So there's no even a way to follow up or even see like trends over time. And so there's so much emphasis on the individual, not to only be that person that carries their backpack of knowledge every time they go from one doctor to another. So there's a lot that we have to focus on ourselves. Depending when our government wakes up, Nigerians or Africans listen to it, you have to prioritize your health, you know, and if you can spread your healthcare costs over time, you know, over a year, it's going to end up paying for itself, because you want to still, if something's going to happen to you, it's going to happen to you anyways. But won't you want to at least, you know about it, you know, in time? So just wanted to emphasize that. And so I think that kind of brings me to the final question here, because I don't think I'm not seeing any question in the chat, will be, how can we help? How can those that are listening? Because I know, I mean, I've been a beneficiary of what you're doing, not directly, but everybody that I've, you know, referred to you see, you told them, it's okay, you know, give them my number, you know, and you talk to them, you walk through them. Oh, a question just came in, sorry, and I need to ask this. They want to know, how good are facilities available to give proper treatment to cancer patients in Nigeria? What of oncologists? Can patients readily get access to genuine doctors in the appropriate field of cancer treatment? Take, for example, medical oncologists, radiography oncologists. Is the NGO doing anything to discourage activities of unqualified surgeons carrying out cancer surgeries? Wow, that's a very robust question. And this was sent to me privately, by the way.
Okay, thank you for that question. We have a dearth of oncologists in Nigeria. I believe we have less than 100. I don't know if it's increased over the years. The last I aware of, we had less than 100 oncologists, and by that I mean clinical radiation. I'm not sure we have medical oncologists in Nigeria.
Isn't that just sad? I mean, no, we have the brain drain.
I think the curriculum.
Oh yeah.
I think the UK curriculum. This is not my area, so I'll have to probably do a little bit of reading on that. So we actually call them clinical oncologists, but we don't have medical, because I remember there was some time ago, an organization reached out to us. They wanted to start a medical oncology fellowship in Nigeria. So we have clinical oncologists, radiation oncologists. I'm not sure if we have medical oncologists, but we might have, so I will have to check on that. We don't have enough cancer centers. We don't have a comprehensive cancer center. I mentioned that, like we can call it Cancer Center of Excellence, whereby you have everything under one. That being said, trust me, things are better now than they were a couple of years back. I believe it was 2016 or 2015 that there was no single radiotherapy machine working in the whole country. None, not one, they all broke down. But since then, and it was due to the efforts of organizations such as ourselves who were really advocating for this, you know, there were lots of press and You know, why would we not have a radiation machine in the whole country? Patients were
Sending people to
dying.
Ghana and South Africa
People were
and
going to
India.
Ghana, India, and those were people who could not afford, were just dying. You know, so then there were some investment, private sector came together with us. So we now have a few new machines. Luth has about 3 radiation machines by variant. And there's a new private center somewhere on the island. I also have, I'm sorry, not Lakeshore.
Okay. Oh, that one that I think we talked about it on Instagram when it came out. I forget their name.
Yes.
Yeah.
So there's that one too. So, I mean, it's getting better, but it's not enough. Up north, up country, we have in Abuja, there's, I think, 2 radiotherapy machines in Abuja. In the east, I think we have about 2, you know, so it's not enough. And regarding access to qualified oncologists, the oncologists are doing a good job. They're working with the best they can, with what they have, you know. I know I can vouch for the Luth Cancer Center. If anyone wants to get treated for cancer in Lagos, that is where I will send them to. So it's a partnership between Luth and NSIA, the National Sovereign Insurance Agency Authority. They came together and you know, overhauled the old oncology, and they now have a brand new center. So they have the new machines, they have the expertise, they give radiation. I mean, they give chemotherapy, they have chemotherapy drugs, they have professionals from outside the country also working with them. So yes, I would recommend them, but we need more centers, we need more experts. Oncologists outside Nigeria, Nigerian-born oncologists who are working outside, they can come and donate their time and expertise and help grow this space. We need all the help we can, seeing that we are seeing a rise in the incidence of cancer. Regarding quacks performing surgeries, I mean, that is a big problem. And I'm sure from all I've said, you can find out the reason why that is a problem, or why there's a rise in it. It's because there are not enough professionals to handle the cancer cases, to handle the biopsies and things like that. And then there's lack of access. So for example, at CancerAware, if you receive 10 calls a day, 8 will be for information. Where do I go to get the biopsy? Where do I go to for a mammogram? So the populace don't have that information readily available. We are trying our best to fill the information gap, but the reality is there's so much we can do to reach, especially people outside the major cities. So these quacks, you know, it has to be from a policy level, it has to be from the government level to tackle them, you know, to clamp down on their activities. A lot of cases have been mishandled because they don't know what they're doing. Presently, we have one young lady who found a lump about a couple of years back, and they took her to one doctor, a so-called surgeon, and he did what he said was a biopsy. And then the wound never closed. The wound never healed till today. It was just, then he was now pumping her on antibiotics, dressing the wound. Anyway, by the time she was referred to us, you know, we now sent her to get a biopsy done properly. And then they asked the doctor who did the biopsy about it the year before, that what about the histology? And he said he couldn't find her file. You know, we've had cases of these so-called quacks taking samples and throwing it away. You know, so it's a huge problem. I really appreciate that question because it's a challenge. It's a challenge so that's one of the gaps we're bridging, to get people the right information, the right places to go to seek help.
Yeah, I should just add is that the problem of the lack of oversight that we see in the healthcare system in Nigeria is no different from the way we see it in, you know, education and all that. It's just that when it comes to health, lives are literally at stake. And I mean, education, we can make that same argument, but it's not very equitable, right? So depending when the government, you know, they have like strict guidelines to like make sure that centers are standardized and you can report things. They have, you know, whistleblower, I guess, opportunities in place. The onus is on you as an individual. Again, it goes back to, there's so much you're doing already that we've asked you to do today, is make sure you're engaging people like Tolu's organization to ask for help and ask questions around. Don't just say because you saw this hospital on your way to work or you're driving to a place, you went to go in there. As for when it comes to cancer, you don't, because when you start something, especially with these biopsies, we've seen a lot of younger girls get into trouble. The doctor say, I'm going to take it out surgically. And it's something that shouldn't have been touched in the first place. And then the cancer spreads and you can't undo something. So the earlier you intervene with the right person, the better. So make sure you're asking questions. You're also, I'm getting second opinion. It's very, very important. We understand that having that C diagnosed, the cancer word thrown at you can be quite overwhelming. Is why, make sure you engage your family members and, seek that knowledge that you need in getting the kind of help that you need. And there's a question from Sarah. She wants to know, how can men be encouraged to get screenings? I can talk a little bit about that, and Tolu, if you have anything to say to that, you can jump in. So I work with prostate cancer, right? And some of the things we've seen that has been quite effective, because they don't really, as scientists, we do know that our words sometimes don't have the same weight in gold. Like take, for example, an advocate. So we use a lot of survivors to talk to people that are still yet to get it done. And that message is quite powerful. When men start hearing that their PP could fall off, they might not be able to use it anymore. That, unfortunately, it has to be fear-based for most of it to work. Another thing that we know that also works is, the women in their lives, so you as a wife, as a sister, as a mom, you have a lot of saying in the men in your lives. So I had a patient tell me that my wife will be the one to schedule that appointment for me. And I cannot get out of it because he's a very frugal person. If you cancel the appointment, you get charged for it. And she will withhold everything. She won't talk to me until I get it done. So using her wily ways as a wife can be, something that can work. So again, our men do so much. They are built in such a way that it's easy for them to neglect their health. Not all men are like that, but for the most part, the way masculinity works is they feel invincible. This is where the power of the soft power as women come into play. So whether you're a daughter or a sister or a mom listening to this, is engaging those loved ones, the males in your life. Try with prostate cancer, it's getting more and more aggressive in our men. And, they are being diagnosed at late stages. Ask them questions specifically. What are the values? Can I see your numbers? And then keep encouraging them to go. It's not when, they're peeing blood or they're not able to get up that they now go to the hospital. And by then it's usually almost too late. Tolu, I don't know if you had anything to add to that.
I think you've covered everything. I just wanted to say that one of the methods we use to encourage people to get their annual checks is to tell them to schedule it around their birthdays. So it's very easy to remember. So see it as sort of an early birthday gift to yourself or something like that. And it makes it easier to remember to do it. And then regarding breast cancer, we encourage men to help women, their spouses, to check. Yes, it's easy for them to help their spouses to check and to encourage them to go for their screenings.
Yeah, and I'm going to put my husband on the spot. So he's a physician, and you'll be surprised just how reticent he was in the beginning to get his own physicals done. This is somebody that does physicals on other people. And so I had to put my legs, no, you have to go get yourself checked, get yourself checked. So again, it can happen to the best of us, but I think this is why we need one another. Our strengths can be played to our advantage in a very complementary manner. So back to my final question, how can we help? How can we help you? I know it could be for monetary donation or even donating our time and resources, but how can we support what you guys do, the great work you guys do at CancerAware?
Very much for the kind words. So there are many ways you can help our work. Presently, our patient support initiative is our main focus for this Breast Cancer Awareness Month. We have many women on active treatment that we're supporting. In addition to that, we have a long wait list. So the way it works is based on the resources available, we're able to, cases apply to us, we go through them, they're eligible for our support, we put them on a wait list. If resources are available, we get them into active treatment. And by this, we mean we provide free chemotherapy, help them with surgery, whatever stage of their cancer journey they're in, we support with that. For women on the wait list, while they are waiting, we encourage them to seek other ways to raise funds for their treatment. So whatever donations we get this month of October, 100% of it is going into the patient support initiative so that we can clear our wait list, get them onto active treatment, those who haven't started, and also the existing patients on active treatment, also to help them complete their treatment. So yes, donations. Every penny goes a long way. Every little penny goes a long way to help. It makes a direct impact in the life of someone. On our website, and I mean, if you sign up for our newsletter, canceraware.org.ng/newsletter, we provide updates on some of our patients who have given us, beneficiaries who have given us consent to share their stories. So you will see in real life, real time, what your donation is doing. We offer real time help, real life help to people who need it. It would amaze you to know there are people who have cancer and they cannot afford 2,000 naira for a blood test. If she can't afford 2,000 for a blood test, how would she afford chemotherapy? How would she afford?
That's like $4, by the way, for those that are not.
How would she afford a mastectomy? How would she get radiation? You know, and we did touch on this throughout the show. We are seeing a rise in the incidence or spate of herbal remedies for cancer in Nigeria.
Essential oils,
reaching epidemic proportion. See, most of the women who come to us with stage 4, by the time you take a history and interview them properly, you will find out that they've been on some herbs for like a year or 2 or so. And when things got worse was when they now came to seek help in the hospital, because we have our MobiPink program is being done inside the Luth NSIA Cancer Center. That's where we recruit our beneficiaries from. You know, so you find out, madam, what have you been up to? Why are you just coming? And she says, well, they are usually reluctant to say it because in a way they know what they've done is not right. It's not the correct thing to have done. And they reluctantly give up that information and say, oh yes, I was taking this herb, I was drinking this potion, I was taking this supplement. And it's interesting to know more that these herbal remedies or alternative remedies, they are not cheap. They don't come cheap at all, you know? And they would just say, oh, just don't worry, just drink. Don't take chemotherapy. Don't take chemotherapy. Chemotherapy is not good, it will kill you. Just keep drinking this. And they will take it and get worse and worse. And by the time they come, it's stage 4. And, you know, so donations, one of the ways you can help. We need every help we can get in that regard. You can also share our educational posts and resources, which we have on our website and on our social media handles, especially our social media pages. On CancerAware, Instagram, we are at CancerAware_. On Twitter, we are at CancerAware NG. Facebook, we're CancerAware Nigeria. Because like I said earlier, awareness is the first step in the fight against breast cancer or any chronic disease. You know, so share it with your family, friends, contacts, encourage them to go for their screenings. By that, you are helping us to achieve our mission of reducing the cancer incidence in Nigeria and late presentations. So those are some of the ways you can help.
Wow. Thank you so much for that. And I know this is Breast Cancer Awareness Month. That's why I'm wearing a little bit of pink. And I know you guys, yes, 31 Days of Pink. They also have their Support Her and then their Patient Support Initiative. I subscribe to their newsletter and they just have a way of just bringing information in a very concise way. I know the last one I read was about Abisola, the 21-year-old girl who had the diagnosis of breast cancer. But thanks to you guys, you're able to cover her 5 cycles of, chemotherapy at no cost. So guys,
she's doing very well, by the way. She's doing amazingly well. Amazing.
It's just good to hear. I mean, at 21, at 21, 21, it should be on TikTok, dancing and all that. She had to go through cancer, therapy at 21, treatment at 21. So it goes to show you that it's quite pervasive, at that age. And so for those that are listening again, here's a reminder, go get your health checks done. It's not just for cancer screening, it's just your overall health. Because when you're in good health, you're in good health. Whether it comes from one, whatever happens as far as, whether you have an underlying condition, it might or might not be cancerous. But at the same time, you need to know your numbers, know what your body is like. And don't just stop at that, make it a yearly thing. Tolu suggested doing it as a birthday present to yourself, And so save enough money knowing that, on this day of the year, I have to take myself to the doctor. And it's a good thing to do. It might be scary, but then you get comfortable with it. And so we've talked a lot today, and I just want to say, Tolu, thank you so much. And we believe strongly on the show to support causes that we know would have that impact on the community. And so as someone who's been touched by cancer, not personally, but I definitely have known people who have died from it, and I've also lost a father figure from it. So on behalf of everyone at the show, and also my husband as well, would like to make a donation to your organization of $200. So I will be in touch with you on how to remit that payment, because we know that it's going to go a long way in offsetting costs, especially for indigent, cancer survivors or even cancer patients in Nigeria. So that's just, our donation to you from the show.
Thank you so much. That's so kind of you. Thank you, everybody. Really cool.
All right, guys. Well, this was it. Tolu, I don't know if you had any final words or things you'd like to leave with our listeners today before they go.
Thank you. Nothing. I think we've covered a lot. I would just keep encouraging everyone to please do their health checks regularly. If you're a woman and you're listening, please, if you've never done a pap smear, get your pap smear done, or if you're overdue for one, get your cervical screening test done. It could be a pap smear or any of the other ones we mentioned earlier. If you're 40 and above, please schedule your mammogram. If you're below 40, speak to your doctor about getting. In Nigeria, we do a lot of breast ultrasound because of the density of the breast for younger women. So that I don't know about in the US and other places where people are watching from. Or you can get your clinical breast exam done annually. But the breast self-examination every month is crucial. Get to know what your breasts look and feel like. If the know your normal slang, if you know you're normal, if anything untoward or abnormal is happening around your breast, you can easily tell because you know how your normal looks like or feels like. And if you find any abnormality, please seek medical help. Encourage your family, friends, contacts to be proactive about their health, not to be afraid of knowing, not to be afraid of knowing if there's a condition and to take steps to seek help early. So that's all I'm going to say. Thank you for your time. Thank you for joining in, everyone. I really appreciate it.
Yes. And remember, some of these things don't have visible signs, and some things could be going on inside and you might not know. I'm going to just end this by saying, in the words of Layo Remi Olowo, who's a survivor of breast cancer, and one of the videos Tolu has put out from her team, she said this: ladies, and I want to say men as well, do not be afraid of knowing. Be afraid of not knowing. Early detection saves lives. So everyone listen to it, please get checked, be aware. If you'd like to know more about CancerAware and how you can be a part of them, visit their website right now, www.canceraware.org.ng. Or if you even Google CancerAware Nigeria, it's going to pop up as the first thing in your search engine. I appreciate you guys for hanging out with us today on the show. This has been an initiative of the More Sibyl podcast. I am Mo, and thank you for joining us, and really, really appreciate your questions, your engagement, and your time. Please be in good health, and God bless you guys. Bye, everybody. And thank you, Tolu. I'll be in touch with you on how to remit the payment.
All right. Thank you so much. Bye.